video. Today we are talking about teething in babies because Fiifo MPH is teething and he woke up. That's his unusual self. He usually wakes up after 7:30, but today he woke up before 6 and we slept around 2. He's very irritable. This is the second set of teeth that is coming. Anyway, so I wanted to make a quick video on teething and how to relieve them. He's at my back. Yes, darling. All right. So teething is when teething is when they show signs or their teeth start erupting. Usually, it starts from this lower 2. That's the first set of teeth that usually comes, and then this upper 2 will be the set of teeth that follows. All right. So teething usually happens between 4 to 9 months. However, you might find one babies. When I say one Ghanaian language, you might find individual babies who teeth before 4 months. That's okay. They are not a lot. Maybe out of 10 friends, one child or 20 friends, one of their babies will start teething by 3 months. That's okay. A friend's baby is 8 months and nothing has appeared yet, and that's also okay. Some people will start getting worried that what if there's not enough calcium in his food? What if he doesn't have this? And I say, if the baby is able to stand, if the baby is able to crawl, it is being irritable. Hold on. So we are back. It's here. So someone will say, what if he doesn't have enough calcium? That is why a 9-month-old man, 8 months old baby will not have teeth. If the baby is able to stand, if the baby is crawling, if the baby is sitting, the probability of not having calcium is very low. However, if you're always worried, please see a pediatrician. Okay. And so they complained yesterday. The baby is 8 months and very much well crawling, is able to even cruise. When we say cruise, able to stand. If you give him support, he's able to move a bit on his own, and they are worried about his calcium levels. I said, this baby doesn't have a problem with calcium levels. It will come. Most babies' teeth appeared around, I think, 9 to 10 months. Yeah. I think 10 months is a bit of maybe around 8 to 9 months yet. And she was already chewing a lot of things, even on her gum. It's strong. God is wonderful. Okay, so Fifi is 6 months. His first teeth erupted when he was 5 months. In fact, before 5 months, 4 months going to 5 months, that's when it appeared. So what are the signs and symptoms of teething? Fever. Now I'm making this video specifically now because he's teething and he's been irritable, and we are all irritable because I haven't slept. Grandma too hasn't slept. These symptoms may not appear for every baby. I repeat, these symptoms may not appear for everyone. So Fiifo MPH is having a temperature. His is very high. Maybe someone's temperature might be low. He's very irritable, crying. He's not a crying baby. Fiifo MPH is not a cry baby, not like this baby. But now he's doing a lot of wee, and we understand that it's because he's teething. Number 3, some babies might vomit or have diarrhea, and suddenly the baby is having greenish stool. Please, with that, I always say report to the hospital to make sure that it is not a gastrointestinal infection before you conclude that it is because of his teeth. It's not every baby that she'll vomit or she'll have might have temperature, vomit or diarrhea. Do not stay at home and say, oh, listen, if you think here, oh, it's because he's teething, that is why he's having diarrhea and greenish. So please, no, report to hospital. Let us check. Let us do the initial check, and then we can finally confirm that it is teething. All right. Apart from that, they want to be grabbing things, they want to be biting things. You realize that when you give your finger to them, they will be no one. Okay, go and fetch water with grandma. I'm waiting for you. Okay, good girl. All right. So we've talked about temperature, irritability, the irritability that comes with crying, vomiting or diarrhea. I say you should report to the hospital. What are the other? Might be cough here and there, please. Fifi had just that small cough be here and there, please still report to the hospital with that. Their sleeping pattern might change, and their eating pattern might even change. Fiifo MPH, I realized his sleeping pattern has changed. He's barely sleeping. Yesterday, he did not even sleep 20 minutes on a bed the whole day. And that is so unlike him, because he's 6 months and he's able to nap during the day for 3 hours, 2 to 3 hours or better at a go. He didn't sleep for even 20 minutes. Immediately you put him on the bed, roughly 10 to 15 minutes, he wakes up and he starts crying. He was at my back the whole of yesterday. It's been AMA. All right, so these are some of the commonest symptoms we see in babies who are teething. Now, what do we do to relieve them of their pain? If you have paracetamol, if the child is running a temperature, please give paracetamol. All right, it will cool them down and it will relax them, and it will take a bit of the irritability. There's a bit of pain as well. Remember, they cannot say. That is why they make it all into their teething powders. In the pharmacy, please make sure that it's prescribed or it's appropriate for the baby. It's not every teething mixture that must be used. Some of them might have harmful substances. There are some teething gels as well. I'll show you. I think I have a video on that. And then as well, you can put these things. It's called teething rings in the fridge. For it to be cold, you give it to them as they bite on it. As they bite, remember it has to be clean, wash it before you put in the fridge. As they bite on it, the cold is giving them relief, and already because they are teething, they want to bite on hard surfaces. So things like this also usually help. Just wash it and put it in the fridge. Don't give them something very hard in the freezer. Someone might say, "I'm an ice blocker." No, you might hurt the baby. This is okay. Or you can even put their towel, small towel, wet it and put it in the fridge. Give it to them. It suits them as they put it in their mouth. Okay. So all the best with your baby that's teething. I'm really extremely tired. Woke up at slept around 2 and woke up before 6. But just know that this shall pass. If your baby is being this and you think it's teething, I'll show you when I remove it from his back. I'll show you how it looks when they are teething. Okay, so that you can be sure that place will be the gum will be reddened, and you will see that when it starts reddening, it will get to a part where it looks a bit whitish, and then when you feel this, imagine this diagram. When you feel, you might feel something rough there because the teeth is erupting. All right, I'll show you on Fifi's gum for you to see. You see the gum is a bit swollen, and when you feel the gum, you feel some bit of roughness here. For teething, you can use this Bonjela soothing gel. As it's written here, it soothes and calms sore gums, and it's fast acting. I've prescribed it for people. Personally, I haven't used it on Boss Baby before, but I know it works. And so this just localizing, applying it on the gum where you think the teeth is erupting. So if you think it's coming on the down part of the gum, you just apply it. It's a gel. It comes in a paste, a tube like this. So you just bring it out and press the gel and apply it on the gum. And that's just normal para. You can get any brand. That's a panel. You can get any brand you want. If the child is running a fever, you give the right dosage. And then as well, you can use teething powder. Teething powder you can get in most of the pharmacies. That one as well. All you have to do is form a paste, the teething powder. Either you apply directly onto the gum, just like this one, you apply directly onto the gum where the teeth is erupting, or you make it into a paste and apply it there. It's very simple. You can get all these over the counter. So yeah, I forgot to add, yes sweetie, hi darling, I forgot to add that when they are teething, they also drool a lot. They have a lot of saliva in their mouth. You're wondering why I'm outside? Because Boga is still very, very irritable. Yes, he does not want me to sit down. So we've been standing. He's not slept on a bed today for even 5 minutes. He just wants to be held and it's all the teething. Now, I want to say that teething is a diagnosis of exclusion. What it means is do not stay at home and behave like you're a doctor if you are not. When you haven't examined child, you don't know whether the temperature or the irritability or the vomiting or the loose stool or the whatever is happening to child might be another thing. Do not stay at home. When someone come to see me in the consulting room, child had been sick for 3 days. She said, oh, it was teething. My mother said it was teething, so we stayed at home and they came for admission for because it wasn't. So it's a diagnosis of exclusion. Go to the hospital to be sure. Let the doctors examine. Now, after we examine and we tell you that, oh, definitely this is teething, then you know that, oh, you are safe. But then if you stay at home and you do yourself a maga, you go on Facebook and go and write in all these social media handles. It's good you go right there and ask your questions. But not when a child is having a fever. Not when a child is irritable. Not when you take your child's sickness to social media. All I'm saying is run to the hospital if you aren't sure what exactly it is. Don't stay at home and say it's teething and something should happen to your child. Now here we are. Oh, he's falling asleep. So I think we can go and hoping. It's almost 10 p.m. Let's see the time. Yeah, it's 9:47. Let's see whether he can lie down. I just needed to do this video because I haven't slept more than 4 hours in 2 days now. So it's been tiring. Let me know in the comment section below what you did to relieve your child or what you're also going through. Mothers are we are outside. We are outside. Hey, Manyani, you ready? My nurse was walking him up. Bye.
Buzz, 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 buzz.